I pulled this one because there was a comparison to Clomid, and people were asking about, well, what about Clomid for TRT? And we didn't pull all the data there, but there's some fairly robust data with SERMs in general.
We briefly mentioned nasal testosterone and some of its benefits. And as we mentioned previously, one of the main reasons to go on TRT is to prolong the quality of life, but maybe a way that sounds more acceptable is to prolong your health span. So it's easy to say, well, quality of life doesn't matter. You just want to live as long as you want to live. But if you've participated in end-of-life care or had a loved one with neurodegenerative disease or debility of age, then it seems quite reasonable to target a health span goal or a centenarian decathlon of your choosing or whatnot. But this one looked at nasal testosterone, and it looks quite good for quality of life.
Yeah, and this was actually, I pulled this one because there was a comparison to Clomid, and people were asking about, well, what about Clomid for TRT? And we didn't pull all the data there, but there's some fairly robust data with SERMs in general that point to an increased risk of VTE consistently. And this, Clomid is commonly prescribed off-label to treat hypogonadism or to improve fertility, because if someone comes to you and they've got low T and they say, hey, we're planning for a baby in the next year, you probably shouldn't put that person on a long form of injectable testosterone. The nasal gel testosterone has some interesting data. It looks like in this case, fertility was preserved, and their libido was actually better on nasal testosterone gel than on the Clomid. And there's papers on both sides of this with Clomid and improvement in sexual function. There's one paper I'm aware of that shows specifically a decline in libido from starting Clomid in a hypogonadal male. So I shy away from that. I don't tend to start people on Clomid. There are specific cases for its use. Just like any medication, there's always a time and a place for it.
If your clinic can make a lot of money prescribing it. And we'll have a full podcast. We always get lots of questions about Clomid. Literally today, I've gotten multiple questions. Should I just take Clomid? And we'll have a podcast on any selective estrogen receptor modifier. But being a strong agonist and a strong antagonist in every tissue in the body has a lot of risks that come with it. Usually very similar risks to TRT, and much less benefit other than preserving fertility acutely. So sometimes preserving fertility acutely or using it as a fertility med, that is a huge benefit, being able to conceive a child when you like to, kind of similar to contraceptives. That it outweighs almost all of the risks, which are mostly long-term. But that's how you look at it as basically almost always a slightly worse option than TRT, unless you're acutely desiring fertility.
I think that's a great take.